The award for Outstanding Member of a State Legislature goes to Cindy Friedman. Ms. Friedman represents the 4th Middlesex District in the Massachusetts Senate, where she serves as Senate Vice Chair of the Joint Committee on COVID-19 and Emergency Preparedness and Management, and Senate Chair of the Joint Committee on Healthcare Financing. In its nominating letter, the Massachusetts Medical Society describes Senator Friedman as masterfully legislating with a North Star uniformly set on the best interests of patients, especially the most vulnerable. During 4 years in the Massachusetts Senate, Senator Friedman has distinguished herself as a leader on numerous healthcare issues. During the pandemic, she has played a key role in crafting and passing legislation to shield residents from the devastating impact of sickness and job loss, providing housing and food assistance for those in need and financial support for small businesses. She championed first-in-the-nation legislation to promote broad access to medication to treat opioid use disorder and to promote harm reduction strategies. These are both recognized as evidence-based approaches to addressing the overdose epidemic and key priorities of the AMA. She is not afraid to take on powerful interests for the benefit of patients, pushing back against health insurers to expand telehealth services, fighting for mental health parity, and confronting the pharmaceutical industry over excessively high prescription drug pricing to make medications more affordable. Senator Friedman, on behalf of the American Medical Association, please accept our congratulations for this award for your outstanding government service.
Hello, I'm Massachusetts State Senator Cindy Friedman, and I'm honored to be receiving the AMA Outstanding Government Service Award this year. Thank you to the Mass Medical Society and the President and my good friend, Dr. Carol Allen, for nominating me for this award. Amid this global pandemic, I want to recognize the thousands of doctors in the AMA's ranks for your commitment to public service and for your collective efforts to keep all of us safe and well during these extremely challenging times. As a policymaker, I've learned a lot from this pandemic, and I've learned a lot from partnering with groups like the AMA and MMS. It's clear that we must address the many systemic inequities that impact healthcare. One approach is to ensure that the work of the doctor remains focused on taking care of patients. We all know that patients thrive when they're making connections with their doctors, and to amplify this, we must ease the burden that take doctors away from directly caring for patients, like time-consuming paperwork and insurance protocols that focus more on a carrier's bottom line than on a patient's well-being. Doctors should be evaluated on the quality of the care they provide and not the quantity of patients they provide for. Standards based on maximizing the number of patients seen are a disservice to both patients and doctors and reduce the quality of health care. And just as important, we must support and provide for a well-funded, well-staffed healthcare workforce to address the challenges faced each day by the medical field, especially in this enduring pandemic. These things are worth fighting for, and I will continue to work with the AMA and the MMS in the years ahead as we strive for a more equitable, more accessible, and more affordable healthcare system for all. Thank you all so much.